Today, the patient is very technologically savvy and is looking for holistic experience before, at the time, and after the diagnosis. They really want to be involved in that decision making. They're also looking for information that needs to be on demand in the right format and in the right channel. Patient wants to have more control over their decisions that are being made along a patient journey and also has now developed expectations around realizing their own consumer experience.
Welcome to the Life Sciences Leadership Podcast, where we delve deep into the life sciences industry and uncover effective strategies, innovations, and future trends. Your host, Axtria's Jasmeet Sawhney, engages highly acclaimed leaders in discussions focused on directing commercial success in the life sciences industry. Whether you're transforming your commercial success strategy or just craving dynamic discussion, this is the show for you.
Hello everyone, I'm your host Jasmeet Sawhney and welcome to the Life Sciences Leadership Podcast brought to you by Axtria. Our goal with this show is to bring to you effective strategies, innovations, and most importantly, people who are driving improved business and patient outcomes within the life sciences industry. Our guest today is Vishal Singal. Vishal is currently the Patient Engagement and Digital Health Lead at Axtria. Before Axtria, he held various leadership roles in previous life at IQVIA, Accenture, PwC, and Infosys. He's a recognized patient engagement and digital health leader focused on creating patient-centric solutions and improving patient outcomes. Vishal has helped senior pharma executives improve brand performance and patient outcomes by bringing together clinical, business, technology, and traditional and non-traditional sources of healthcare data. He has helped brands find and reach the right audience using AI/ML and advanced analytics. Vishal has a global focus, helping clients across US, Europe, Asia Pacific, Latin America. He has significant experience in executing with large teams and bringing together vast array of capabilities to drive transformation across the enterprise. He has been widely published on topics that center around patient experience, digital enablement, and patient data. Vishal, thank you so much for joining us today and welcome to the show.
Thank you, Jasmeet.
Vishal, before we get deeper into patient engagement and how to drive it, let's start with the definition. How do you define patient engagement?
Jasmeet, patient engagement is a very broad topic, and how to define it and lay your arms around it is a very difficult perspective, but I'll take a stab at it. How we define in Axtria it is how patients are involved in a healthcare system, how it really impacts the overall involvement of patients, how they start taking part in their healthcare ecosystem, what behaviors they show that really drives patients' positive outcomes. It means that the ecosystem must be focused on the patient, and patient is the true center. And that's a lot for a lot of companies to think about and execute on it. Engagement, finally, I would say engagement is all about targeting the right patients in the right channels with the right content, so that we can measure the right KPIs from the engagement perspective, but also take feedback from the patients and close that feedback loop with a focus on continuous improvement. And that's how we think that patient engagement should be defined, designed, and executed.
Right, that makes sense, Vishal. Patients should be at the center and they should be involved throughout the process to actually improve that patient experience. So thanks for sharing the definition with our audience. As you know, a lot of the traditional approach to patient engagement is now being challenged. For example, there is so much more focus on patients being considered as consumers. Can you provide some insights to our audience on why there is so much pressure against the traditional approach?
We are far cry from where patients can be real consumers and HCPs can be real providers. There's a lot of expectations, but I don't believe the healthcare ecosystem supports that. If you go by the dictionary meaning of patient, a patient is someone who is able to accept or tolerate delays, problems, or suffering without becoming annoyed or anxious. If you think about that definition clearly, that means that everything that you do for a patient has to be passive, and the patient is at the receiving end. It is more sympathetic view of the patient rather an empathetic view. Today, the patient is very technologically savvy and is looking for holistic experience before, at the time, and after the diagnosis. They really want to be involved in that decision making. They're also looking for information that needs to be on demand in the right format and in the right channel. Patient wants to have more control over their decisions that are being made along a patient journey, and also has now developed expectations around realizing their own consumer experience. So when you think about patient as a consumer, think about all these different things, why these aspects don't really gel together, but that's kind of where we want, that's aspirational, that's where we want to move. And that is very contradictory to what a traditional understanding of that patient is. On the other hand, a provider is someone who provides something someone needs, while an HCP stands for all the healthcare professionals, providers, practitioners like physicians, nurses, pharmacists, institutions, who may prescribe medical technologies or related services or drugs for a patient. But now the expectation out of the HCP is that as a provider, they have to not only provide all those things, but they have to be all encompassing for everything that a patient needs. It's not about just diagnosing a disease, but making sure they can get access, making sure that they are taking care of their behavioral needs, making sure you're trying to tell them about how a pharma company may support them in terms of their copay, in terms of any other support needs. So now you think about it, how the HCP's overall definition is changing from a provider. Now, why this is all changing is because of a lot of the macro environmental changes, whether it's advancements in technology, advancement discerning of more information across different channels, and also how everything is becoming Amazonized. Amazonized means everything you go to an Amazon website, you can get everything, and that's something that they feel that should be translated into healthcare. And that is why all this is forcing healthcare to change and bring these new terminologies such as consumer and provider.
Yeah, Vishal, it's amazing how you started with the summary itself, empathy versus sympathy. That kind of summarized the whole thing in a very nice way. And it makes absolute sense. Now, switching gears a little bit, can you talk about the current state and some of the key challenges that are limiting pharma's ability to improve patient engagement? I know you talk about access, education, awareness, and digitization. Can you elaborate on these?
One thing I feel the most important challenge is not about these aspects, but how siloed they are. What a patient needs today is not more noise, but more an integrated view along that journey, where it is making sure that he or she has the power to get that information at the right time and make those decisions. And that is what I feel is missing every time pharma companies or payers or providers, they are throwing more things at the patient, and that's what becomes a problem. Now, let's take the example of access. Access is a huge barrier. You have different layers of access for commercial, Medicare, Medicaid patients, but different types of behavior exist, such as cost, access to care, medical literacy. Now, when you think about this, the overall high healthcare costs have to be addressed by all stakeholders, such as lowering the cost of essential drugs, making sure the patient is not making choice between putting food on the table and buying a drug. It was, I think, a couple of days ago, we learned Lilly is now capping the insulin at $35.
Yep.
Yeah, it's a decision little too late, but don't you think that somebody could die if they don't get insulin? And there's a problem in this country where you are rationing insulin when that is your most important need to survive, which I feel is a good decision to improve access for patients who are suffering from type 1 diabetes. What that'll do is they'll get more engagement. Engagement is not just defined by whether the patient is actually engaging, but there's also some of these other barriers that we are talking. Access can also be improved by leveraging technology and using telehealth as an option. We saw a lot during COVID-19, that
Right.
how people were able to access physicians even though they were not able to go to the physician office. And there are things that we could do for rural patients for getting access to specialty care. That really improves engagement. In addition, patient history, which is a far cry, should be a real time, portable, and made easily available to a patients, where patients have a choice to choose the institutions that they need to choose at the time they need to choose, because that interoperability will really improve access. Now, let's take the next one around awareness and education. Now, awareness and education about the disease are becoming important factors for people to get diagnosed, understand the various options that are available, and make treatment decisions to improve outcomes. So, what we have to understand today is, because of the technological ecosystem that's available, patients look for things. Normally, they search on Google, or they search, go to brand.com site, trying to search for all that information. But what matters is, are they getting the right information? Are they getting aware of that disease? Are they getting aware of some genetic disposition that they may have? They should go to a particular physician and try to take more control on their disease. Only when these things happen, we can think about real awareness. For this to happen, we really need to think about patient cohorts that have to be at a microsegment level. What does that mean? What that means is that we need to understand not only from a clinical perspective, but also from their behavioral traits perspective to get a complete picture of their choices. So, for example, if I am a patient and you are a patient, we are in the same disease, but we have different behavioral traits of how we consume information. Our engagement is going to be determined on whether I get that information in the way I want it compared to the way you want it. So the one size fits all does not work in the overall awareness and education perspective. All this can be achieved. What we have is a very good scenario where technology has advanced so much. And, with iPhones and everything else is on an app nowadays, but this can be achieved with technology and digitization, where companies can tinker with that information that is contextualized and meaningful. What that means is that when somebody is looking for a certain kind of information, you can get the next best action based on that. And that is so important for companies to ascertain that ecosystem is designed to create patient-centered health choices and solutions where patients can drive their own experience at the speed at which they are comfortable with, and the way they would love to engage. So to me, those are some of the very important factors, how the current state needs to be a future state. And although all these things may not be done in a day, but those are some of the steps that we need to do, and not do all the missteps that we have been doing over the last 10, 15 years, where digital revolution hasn't really driven value across the healthcare system.
Yeah, and Vishal, I love the way you describe the current state of patient engagement, because you're taking a very holistic view of it. And there is clearly a lot of work to be done to improve patient engagement. Now, let's focus on the solution. Can you tell our audience what needs to happen to drive better patient engagement?
Sure, sure. So, like we talked about some of the aspects in the previous question, right? The core of everything patient starts with having an ecosystem that respects their privacy and is also interoperable. So, for that to happen, you have to have policies. And you can see the policies came out of more necessity during the COVID-19 days. On May 1st, 2020, CMS published that CMS interoperability and patient access final rule. What that did is establishing policies that advance interoperability and access to health information for all stakeholders. It's a step in the right direction, where all different stakeholders can collaborate and easily exchange information to get better engagement and outcomes. But is that happening? Probably not, because now you can see there are different EMR players, there are different healthcare systems, there are different vendors for second, third party data. It's not something that is easily interoperable still. But in doing so, if we do that, we can move from patient cohorts to individual patients and whole and Amazonize that experience, because each patient is unique. For example, a private provider search should give a total picture of what each doctor provides. Today, you just get a provider's address and their rating. It should provide disease specialties, channel preferences, same day appointments, telehealth options to improve access and engagement. Patients tend to give up very easily if they cannot find the right provider. So now you have technology, but while you're using technology, you should think about designing those digital front doors to their patient services where they can push a cultural change. Now, when you think about digital front doors, you will find every company you go to, or let's say you go to a doctor, health the provider will have its own digital front door. Then pharma company will have its own digital front door. You go to physical therapy, they'll have their own digital front door. Now what happens? Nothing is interconnected. So how is that going to change? So that interoperability becomes an important aspect for us to really drive that patient engagement. Now, what I've seen is there have been high quality tools that can be made available nowadays in terms to drive good outcomes. Let's look at patient support services programs. A lot of the programs today, they enroll patients, they do the benefit verification, and then they have all these nurse educators. But there are technologies available that you can actually now do gamification to enhance patient commitment by putting game elements such as sense of community, social incentives, rewards, achievements, personal goals, setting into a healthcare context. You can also nowadays, use digital twins to really make sure that if patients are not adherent, you can showcase what could happen to them as their disease progresses. Because there is a sense of fear in patients in terms of outcomes that also drives adherence sometimes. But giving them a true picture of what can happen if they don't do certain things, I think it is important. And then there could be insightful alerts, which can specify tangible actions for patients and likely consequences of not taking the recommended steps. These can help in terms of helping patients stay on course, resulting in significantly higher patient engagement and better outcomes. Another example I can think of is you can tie symptom checkers for providers, electronic medical records. For this, you have to work with the EMR providers, do some kind of a meaningful collaboration and create processes and tools to drive engagement and outcomes. I think overall, I feel you don't need too many new things, but you need those things that are already there to really drive that execution and integration. In the VC world, they talk about ideas are dime a dozen, but it all depends on execution. Right. I think so. That's what I think is the key to drive patient engagement.
Vishal, I really like your thought process here because you're talking about the ecosystem and a lot of the elements are in place. It's just about putting them together to deliver that experience and deliver that, what do you call, the everything patient mindset that needs to be there. Now, in my final question, and it's a great segue from what we just talked about, I would really like to focus on how you're approaching patient engagement. Can you talk about some use cases and how you're helping pharma companies drive better patient engagement?
I think we need to be real, right? How we're doing this rather than talking more about things that can be done. So when we think about patient engagement, holistically, we think about 4 key dimensions, right? Do we understand the patient's preferences and goals relative to a therapy area? That's very important. Second, are there elements or tools that are set in an ecosystem that develop trust and transparency with that patient? So do we have those? Is the patient going to depend on those? Is the patient going to be really focused on those? The third thing I can think about is that integrated experience that I've been alluding to by breaking siloed patient solutions. What we think about is not a revolution, but an evolution. So I think that's the key thing that we want to focus on. And then the last thing is, can we find those right target patient cohorts to target them across the right mix of channels and seek feedback for continuous improvement? Because every patient is different. Understanding their goals and preferences makes things simpler, and they go a long way in creating empathy. And that, to me, empathy, an empathetic ecosystem can go a long way in creating better engagement. A lot of if I see today, I'll get to the use cases. One thing I want to mention is a lot of our life sciences companies, or pharma companies, outsource patient programs, hoping to get closer to the patient. But doing that, what they do is they're going far away, because what they are is they do not understand what the patient wants. And this lends itself to a vicious loop of mistrust, opaqueness, how the decisions are made, and patient loses trust, and that results in a bad engagement. And then
Right.
from a use cases perspective, I'll focus on 3 or 4 of them. In one of our clients, Axtria wanted to help the client in terms of they had specialty data and they really wanted to look at high-risk patients, identify high-risk patients so that they can target them through their tailored SP nurse intervention programs. So Axtria used their AML methodology to really segment or use that data to understand who those high-risk patients are. And this tailored approach of getting the SP nurse interventions, because they needed more frequency and so that they can have a better reach, actually helped in an average of 30 days higher duration of therapy, which was critical to improving outcomes. In another instance, where we were doing specialty data aggregation, Axtria used as accelerators and processes to improve data onboarding and data quality across SPs, to improve gaps in data that resulting in better visibility along the patient journey. This really helped client design better interventions, which improved overall adherence by around 30%. Because why we were able to do that? Because we reduce the overall patient journey reporting from 6 months to weekly reporting structure. So if you look at it, we didn't do anything revolutionary. But what we did is we plugged those gaps in the data picture, created a more holistic picture around patient journey, and really drove the results that they needed to. Switching gears, I would say another example is around this omni-channel strategy around a rare disease that we are talking to a client. We haven't implemented this yet, but the focus is that they are doing a DTC spend from a contextual marketing spend to people who are searching for certain specific words. The problem there is that you do not know if they are potential patients or they're diagnosed patients. So what we are saying is, let's move that DTC spend from contextual marketing to more specific patient cohorts at a micro-segment level that entails their profile based on their healthcare data, SDOH data, behavioral preferences, as well as their propensity to use certain channels, so that we can not only help optimize the spend in terms of reach, but also determine the right frequency and sequence of channels for their DTC spend. Finally, there was a neurology client that we did some analytics to provide an optimal recommendation for their DTC spend across media. The client was spending around 60 million on media and digital channels, with 90% going to TV, that linear TV and connected TV. What our analysis showed that after 30 million, the spend was not giving them any incremental returns or engagement. So their 30 million was going down the drain. So the idea is, what I'm trying to convey here through these use cases is, are we spending optimally? Are we making sure that we are using the right tools that are available to analyze the problem, make sure we execute on it, rather than just always trying to innovate, but we execute on it perfectly and get the right result. So Axtria does work on a variety of problems. We use our framework, and I think that is our approach in terms of being very problem-centric, solution-centric, than trying to have one size fits all.
Vishal, that's some incredible and impactful work that you're doing. And I'm confident that the work you're doing is having significant impact on not just your customers, but it's actually driving better patient experience and health outcomes. I congratulate you on that. Now,
thank you.
If I were to ask you to summarize our conversation today, what are the 3 key takeaways for our audience?
I think before I say those 3 takeaways, I think it has to be an evolution, not a revolution. It has to be empathetic, not sympathetic. To me, those are very important words. And then I think 3 things what I would say is, number 1, have an ecosystem that's focused on the patient, and patient is in the true center, a really integrated ecosystem, interoperable ecosystem. The second one is then go find the right KPIs that you can measure to really think about from a right patient perspective and right channel perspective. That's very important. The third thing is you really need to understand what the patients are feeling, what they are feeling we are lacking, and then get to that closing the feedback loop with a focus on continuous improvement. I think those are three things that they look very easy, but overall, what I mentioned was it's an evolution and it's an empathetic way of looking at problems.
Yeah, evolution and empathy. Those are the key words. Vishal, thank you for doing the summary. This has been an extremely insightful conversation. You shared your knowledge and expertise about one of the most critical areas for life sciences organizations. Patient engagement is key to success in every therapeutic area. And I totally believe that organizations must get ahead to beat the competition. I'm sure our audience learned a lot today, and they will be able to apply these learnings to their business and prepare for the future. Thank you so much for coming to the show and sharing your knowledge and deep experience in this space.
Oh, thank you. Thank you so much for giving me the opportunity. And it has been a wonderful conversation. Thank you so much.
Absolutely, Vishal. To the audience, thank you so much for joining us today, and tune in soon for the next episode.
Thanks for joining us on the Life Sciences Leadership Podcast. If you loved this episode, please share with friends and subscribe on your favorite streaming platform. For more information, visit lifesciencespodcast.com. Until next time.